Regarding the histopathological grading of the tumor, we actually classify this according to their location. So we say that ductal carcinoma in situ, lobular carcinoma in situ, and then invasive breast cancer is another entity. So what do you mean by lobular carcinoma in situ and a ductal carcinoma in situ? So technically, lobular carcinoma, you can see that these are actually the dilated lobules, and there are malignant changes in the lobules of the breast tissue. And then the carcinoma in situ means that it has not breached the basement membrane as yet. So it's actually the tumors within the epithelium. It has not gone to the lamina propria, or you can say the submucosal layer, but usually it's confined to the epithelium. So carcinoma in situ is technically any carcinoma which is above the basement membrane, that the basement membrane has not been breached yet. So lobular carcinoma in situ and the ductal carcinoma in situ. So the ductal carcinoma is actually involving the ductal system, but it is still confined to the basement membrane. And there is another entity which is called as invasive breast cancer. That means that it has gone far beyond the basement membrane and extended locally, more penetrating lesion. That would be invasive breast cancer. So these are the histopathological gradings: carcinoma in situ and the invasive breast cancer. And then stage obviously depends upon the how much of the tumor is being involved. And there's another classification which is called the BRCA classification, which is usually radiological. And we have already talked about these in the previous lecture. Now, when you talk about the classification of the invasive cancer, so this is called as the foot and steward classification. So it says that there are some diseases which are in a category of invasive cancer, which is the Paget disease of the nipple. Then you have the invasive ductal carcinoma. Then you have the medullary carcinoma. Then you have the which is actually colloid carcinoma, mucinous colloid carcinomas. You have the papillary carcinomas, you have the tubular carcinomas, invasive lobular cancers, and there's some rare cancers like inflammatory cancers as well. And usually at stage 4, usually you have a fungating mass. So remember this foot and steward classification, which is for the invasive cancers: Paget disease of the nipple, invasive ductal carcinoma, invasive lobular carcinoma, tubular carcinoma, medullary carcinoma, mucinous carcinoma, papillary carcinomas. These are all the types or classification of the invasive breast cancer, but most commonly you have the invasive ductal carcinoma and the invasive lobular carcinoma, which is most commonly encountered in our setting.